thanks to everyone for joining. What a great turnout. And from those who have introduced yourselves so far, what a fascinating and terrific mix of perspectives and experiences people bring to this conversation, which is going to be every bit as inspiring as its title suggests. So without further ado, we will get underway. I'm Dr. Nadia Sunderji. I'm the president and CEO at Waypoint. My background is as a psychiatrist, and I practiced for many years until being in my current role. I have a strong interest in what I think of as kind of boundary spanning work, integrated and collaborative care models that create seamless transitions and better access to care across a range of different settings, including connections from the emergency room to urgent outpatient settings and from specialized settings to primary care settings and so on. I have been active in research myself as well as quality improvement, and I'm a little further from that now, but very aware of the terrific work that is happening within Waypoint's Research Institute. And so it's a real pleasure and privilege to learn more about it alongside you today. Lately, my role affords me a greater engagement in governance as well as clinical innovation, and all of which is kind of relevant in the background to today's conversation. So enough about me. I'm going to move on to introducing our amazing panelists, starting with Dr. Soyeon Kim, PhD, who is a research scientist in the area of psychiatric epidemiology at the Waypoint Research Institute. And prior to joining Waypoint, she has worked as a postdoctoral fellow at the Department of Psychiatry and Behavioral Neurosciences at the Offord Center for Child Studies at McMaster University. And as a postdoctoral fellow, Soyeon expanded her program of research to incorporate a systematic examination of social processes and how they relate to mental health problems in youth. Her postdoctoral fellowship culminated in 8 papers, cultivating and strengthening the collaborative network with prominent researchers in the field. And she received her PhD in June 2015 in developmental psychology and education from the University of Toronto. She's also trained and worked as a clinical psychologist upon obtaining her master's degree in clinical psychology. So what an incredible background. And I know you will all forgive me as I read through this part, because I do want to make sure that we really celebrate and recognize the accomplishments and journeys of the researchers who are joining us today. Dr. Elnaz Mogimi joined Waypoint Research Institute as a research scientist in early 2023. Also a PhD researcher. She's a health scientist by training, and Elnaz holds a PhD in kinesiology and health science and obtained 2 concurrent diplomas in neuroscience and quantitative methods from York University. Her graduate work focused on compulsive overeating, e-health interventions, and treatment experiences of women with binge eating disorder. Elnaz was also affiliated with York University's Teaching Commons and received multiple certifications in teaching and peer leadership. After her PhD, she joined Queen's University Online Psychotherapy Lab, where she focused on online mental health interventions in myriad of populations. She co-led a CIHR-funded study investigating the efficacy of online psychotherapy in Canadian correctional workers. Her team also received CIHR funding to explore the mental health challenges and care needs of post-secondary students. So you can already tell we have fabulous panelists to talk with us today about youth and resilience. And with that, I'm going to open up the conversation with a few questions just to get us started. And I will say there will be ample opportunity for questions from audience participants. So please feel free, as Jessica said, to pop those in at any time. And if I don't manage to weave them in, we will definitely come to them later in the session. So, oh, and I should just mention there will be a brief survey to share back feedback after this for future sessions. And then, as Jessica mentioned, the link to the recording will also be available next week. So Maybe just to start with, and this question actually is to probably both of you. I'd love to learn a bit about what inspired your interest and passion in the area of youth resilience and mental health.
Well, thank you, Nadia, for a wonderful introduction. And maybe I'll start. Like you mentioned, I started my career as a child and adolescent clinical psychologist. And then after that, um, I invested like last 15 years or so researching on youth mental health. So, based on my research, I found out the mechanisms, maybe the pathways, the causes, and the epidemiology of mental health among youth. However, upon coming to Waypoint, I just wanted to do something more practical, right? Okay, enough of understanding how bad the situation with youth mental health, but what can we do right now to mitigate those challenges and really support them meaningfully? So that's why I was interested in building resiliency among community youth. And I just believe that building resiliency is more like getting vaccination for your flu. So you may not believe with this warm weather, but it's actually already in October. So many of you may be planning to get some vaccination to avoid getting flu. Uh, so instead of getting the flu and all those nasty symptoms, right, and suffering for weeks to recover from it, you would rather build those immune system so you don't have to go through those suffering. I think building resiliency before you get those clinical symptoms in mental health, you know, is something that you can really do to avoid those situations. So yeah, why not, right? So, and we know for sure that half of the mental health diagnosis happens in adolescence period. And I don't know the age range of all this audience here today for your view, but we once had adolescent period in our lifetime, right? We know how challenging and vulnerable we are going through this adolescence period. There's so many transitions happening on becoming your own person, independence away from your family, going into careers and university and education. So there are so many changes that's happening physically, mentally, and socially. And so building resiliency, the flexibility to overcome all those challenges ahead of you in adolescence is really important. So that's what motivated me to work on building resiliency among communities.
And mine is a very similar path and approach to Soyan. There is enough knowledge. We understand that this is a very pervasive problem when it comes to youth mental health, and we wanted to find ways to actually um, have a positive response to that. How do we address it in the most effective way, in the most meaningful way? And how do we actually give a voice to the people that we're trying to serve so that they can inform the initiatives and the products and the programs that we're developing. So the idea of having collaboration, the not to age myself, but it's been less than a decade that I was in the youth category, and I know what it's like. And I would like to be the same researcher that I wanted to see when I was a youth. I think that sense of advocacy is a part of our job. And so we strive to meet that and to ensure that we don't just create programs, but we advocate for the youth that we're serving.
That's fascinating, and I love the metaphor you shared, Dr. Kim, around thinking about it like other preventative interventions that we're all very familiar with. And Dr. Mogimi, we're going to come back to your comments about the researcher that you wish had been, because I know you both are very active in engaging youth in the research process. So we want to hear more about that for sure. Maybe before we get to that, it might be great for all of us to understand a little bit more about whether the research and interventions that you're focusing on Are they for all youth when you talk about resilience, or are they for folks who have, you know, perhaps are at greater risk of, you know, lacking resilience or having mental health challenges, and sort of how you know who the right sort of target population or intended population is?
I can
Go
answer
ahead.
that. Well, we have synergy, Dr. Kim and I, so for us, we wanted to create a program that's as inclusive as possible. So our age range was quite broad for Pompey, 12 to 25. But at the same time, and this was something that's a testament to why it's important to connect and work with the community you're serving, is that the feedback we got was that an experience of someone who's 12 to 16 or 12 to 18 is quite different than someone 18 to 25. And so we had to be very cognizant of those nuances. And then in terms of the subcategories that we are trying to serve, so this program is really intended for any youth who's interested in enhancing their mental well-being. It's not a clinical program. It has a very proactive approach. It's meant for you to obtain skills and strategies to navigate the challenges that youth are faced with and have worsened since the onset of the pandemic. So we wanted to create a medium and a space where that's a possibility.
Right. Thank you, Dr. Mohimi. Just to add a little bit on top of that, I think, like Dr. Synergy, you just said, the early interventions, the preventative interventions are essential. And I think it kind of goes with my metaphor to vaccination, right? If you wait until you get really sick, you know, the time and the efforts and the resources you require to overcome those difficult challenges are extraordinarily more so. So why don't we start sooner before we get to that point when you really need to invest so much time and already the damage has been done, right? So by us involving the community youth, not those who are already experiencing challenges, is to really do some preventative work so we can protect our community youth before they arrive to those more serious situations.
Thanks. And I know from my experience working in the field for many years, more years than I care to date myself, that of course when people do get to that point, Dr. Kim, they often face a great deal of stigma and other barriers in accessing care as it's another part of the rationale, I think, for intervening early. But what maybe you could tell us a bit about what you've learned, and again, I'll leave it to the two of you to sort of pass it back and forth as appropriate. But what have you learned from youth about what the barriers and stigma are downstream when they need care?
Maybe I can start. Uh, so I just want to do another metaphor. Like, for example, if you have a physical pain, so all of a sudden, you have a stomachache that's really persisting and really painful, you wouldn't hesitate to go to hospital or reach out to your family doctor to get some proper assessment. And you wouldn't hesitate to tell people around you that you're really having this pain. But what if you're feeling, I don't know, difficulty getting up in the morning, going to the school, or, getting your assignments done, and you have difficulty engaging with your peers, right? Would you right away say, those things to your family or your friends and get to seek support? So I think there is some differences between mental health and your physical health and how people approach and access the healthcare services. But I just don't feel that mind and body is like separate and distinctive, right? It kind of interloos with each other and it's interconnected. And as much as the physical health is important, I think mental health is as important as the physical health. So, like you just indicated, Dr. Sundarji, the stigma and the taboo towards mental health, and maybe not so much about the stigma, but not being aware about those symptoms, about those challenges that are as legit as physical pain. Kind of maybe is working as an, how to say, difficulty and challenge barriers to access healthcare in terms of mental health.
Thanks. And are any of those, and maybe Dr. Mogimi, if you want to chime in on this, would you say that any of those barriers, or conversely opportunities are specific to youth? And like I'm curious about, how youth experience that in particular, and then also we'll go to sort of what can we do about it and how we engage youth in that.
Yeah, a lot of the mental health symptoms and mental illness tends to emerge in the youth age range. And it can be very challenging for someone who hasn't experienced these symptoms beforehand to put a name to it and even understand and unpack their experience. And so that's why we're also very much proponents of awareness and to be able to provide our community with the education to understand and identify and even name their experience. And then on top of addressing stigma, it goes beyond just disclosure. We absolutely need to create safe spaces where people can disclose their experience and the challenges that they're faced with, but it's also our responsibility to create programs and interventions to address these challenges. Otherwise, it can be a very it can lead to re-traumatization, and in many cases, we could have youth lose faith in the programs that are meant to support them. So we have multiple angles and responsibilities in order to address stigma and taboo.
That's great. So, what is Pomfy doing about that, or how does Pomfy tell us a bit more about the Pomfy intervention and in particular the role that youth have played in shaping it?
So Pompey is a preventative online mental health program for youth. That's the acronym. It's a mental well-being program, 6 weeks synchronous, and it's led by youth facilitators for those aged 12 to 25. It's fully virtual, and we did this on purpose to make sure it's accessible for youth across the province. And its main intent is to create these supportive environments for youth to have input in the strategies and methods of addressing their mental well-being and have that in a space that is very supportive, because all those involved in both the development and administration are youth. So we always say it's a program for youth by youth. And as researchers, we supported and guided the direction, but we could not have Pompey without our youth lead and our youth facilitators, and we're very grateful for that.
Yeah, just to add a little bit and what Dr. Muhimi just described, the intention is for the youth to be more aware of their psychological well-being. So how do you assess your own mental health status? How do we notice those symptoms and challenges that you're experiencing? And after that, we give them a very convenient and easy to use tools to mitigate those challenges when they experience it. And then we get to know, understand more about some information about their mental well-being, physical well-being, social connections, and have some strategy and plans in the long term. So that's the 3 domains that we are trying to address through this 6-week program.
It sound like amazing youth who have really been empowered through the approach that you've taken. Can you give us an example of something about the program that um, was designed or delivered differently as a result of the leadership of the youth? Like, how did they specifically shape it in this unique way?
So youth were involved in every aspect, the way the slides were designed, our public outreach, what components of the program need to be integrated, um, facilitation. One thing that made our program stand out was when we were actually piloting it, we provided community service hours for our youth participants. So the traditional route is you provided honorarium, but we actually went above and beyond. And the reason why we did that was with intention to really show that your participation, you're not just a data point, you're actually contributing to a program that will serve your community, and you need to be recognized for that. And that actually, the youth participants in our evaluation, they found that to be very fascinating and very beneficial, which we were very happy about.
Super interesting. That's definitely something we would not have thought of had it not been for their input. Now, those community service hours are kind of an expectation in school, right? So, do you want to tell us a bit about the role of schools and sort of what role educational environments can play in fostering resilience as well?
Yeah, I can start with that. Like you mentioned, the particular uh, situation with the youth is that they are still, most of them are minors, and parents and educators and mental health providers around them play a very significant role for them to understand their situation, but also addressing those challenges when they encounter. So the role of educators, the role of school and the parents, family, peer groups, and I don't know, mental health professionals around them are paramount. It's very important because otherwise they wouldn't know what's going on with them, and they wouldn't be able to access any mental health support system to mitigate those challenges, right? And like as we all know, youth, especially those who are still in school, uh, spend most of their time in school, right? More than at home, right? So for teachers to understand their mental health challenges, right, and also guide them to mitigate and providing those safe space that Dr. Mugimi just said is paramount, is the most important, I think, for youth especially, and also the parents, right? So when we kind of put together a program for youth, we also took importance of those people around them because without them, we wouldn't be able to put together a program that's very effective and meaningful for them. So youth should be the core center of the whole project and also all the processes, but it was very important for us to get, I don't know, feedback, comments, and suggestions from the clinicians, mental health providers, educators, and also parents, because they have a vested interest and caring for them as well, right? So yeah, so that's the role they took for putting together this program. But in any research that involves youth, I think it's very important to take into account of their feedback as well.
And just to add to that, we actually piloted Pompey in a classroom setting successfully. And one of the key feedback that we received from participants was how it made it accessible. It enhanced accessibility, and that they liked that they could take a break from their classes and engage in something that is directly aimed at improving their mental well-being.
That's amazing. And I mean, I'm biased, but to me, that feels like that should be absolutely a standard part of the curriculum. And how amazing that would be to offer that preventative approach more widely, sort of at a population level. That's super cool. Now, Dr. Kim mentioned that youth spend, a lot of time at school, more time at school than at home. But it also just got me thinking, like the other place where they spend a lot of time for better or worse is online, including on social media. And I'm quite deliberate in sort of saying the for better and for worse part because we know that there's evidence about the impact of that. There's really almost like a dose impact of that time online and on social media, impacting on their mental health and well-being. Maybe you could give us the flip side of that. Like, what are the positive things that can come out of their use of technology and social media, or sort of how could we flip the script and make that a positive influence?
Well, we wouldn't have a Pompey program if we didn't have technology. So right there, we can definitely advocate for the positive use of technology. And one of the amazing features was the fact that it connected youth from across the province. So we had those from rural communities connecting with youth in urban cities. And then beyond Pompey, they created their own communities, the WhatsApp groups that were sustained even after Pompey had ended. And that was a really interesting thing to see, that we're not just creating a community directly through participation in Pompey, but actually inspiring connections that are sustained. And because they all have that collective mindset of addressing, their mental health challenges or enhancing their mental well-being, we thought, what an amazing thing to see. And then in terms of social media, it is now the number one way to communicate. And for our program to be in the hands and for youth to even know about the existence of this program, we had to leverage social media. And I always say, like, you can create the most incredible program with all the bells and whistles, but if no one knows about it, what's the point? And so social media, of course, has its limitations, and it can worsen a lot of, elements of mental well-being. But when used in a positive way, Pompey is an example of what that looks like.
Absolutely. Thank you, Dr. Mogimi. But like Dr. Sanders just mentioned, like our adolescents are embedded in this internet-based communication technology. They are the groups who were born with smartphone on their hands, right? So when we talk about the impact of social media or like internet-based communication technologies, uh, often there has a lot of literature out there indicating the, I don't know, the negative impact on mental health related with the usage of, social media, smartphone, and internet-based technologies. However, like you just mentioned, Dr. Rogimi and Dr. Sunderji, there are some flip sides as well, right? And I think it's a very positive way to explore that path now that we know that there's no way that we can say adolescents to abandon their smartphones. Where now our way of communication, our way of relating with each other is embedded in social media, embedded in internet-based technologies, and there's no way of getting away from it. So how do we leverage the technology that we have and go beyond that and to use it in a more positive way, right? There are some studies that like that that is the case with Pompey, right? The social media internet-based communication can really enhance the social connectedness between the people and between the peers, especially when there was some social restriction during the COVID-19, when people were not able to gather in person. So these internet-based technologies were very handy to mitigate those situations to be connected.
Thank you. I'm so inspired and moved when I hear about how you really, in a deliberate way, cultivated this community that has had enduring kind of powerful experiences for the youth. And There's a little bit of like, if you can't beat them, join them, right? Because you're right, they are going to be online and on social media, so might as well put something positive out there into the universe for them to interact with. So, what a creative approach. I'm going to back up for a moment because there's a question, a wonderful question in the chat from Irina Ayers, which is about do you still use Pompey at our schools? So I don't know if you could comment on whether there's ongoing implementation in schools or if there's a next step there.
So we piloted the program, and our next steps are in hopes that we could start expanding it, and having other organizations implement Pompey. So the sky's the limit, and we have the data to support its effectiveness. And so now we're trying to see how we can sustain it.
Amazing. Well, you've got some participants today who are really well situated actually to explore that. So I'm just going to go ahead and extend an open invite, if that's all right, for folks to reach out to either of you if they are aware of a venue that might benefit from this approach and you know, are interested to champion that with you. So amazing. That's great. There are so many more things I would love to explore with you. I'm gonna maybe pose a couple more questions to you, but we are coming to the time where we particularly want to make sure that we get to questions from participants here today. So please feel free to add additional comments or questions in the chat. And actually, it looks like Irina has a follow-up question. You said that it's a 6-week program. Do you have a wait list or is there a date set for the program to start? So maybe you could just share with us some sort of practical details about how people can support the youth in their lives to connect up with the program because it is a great resource. So let's use this moment to get the word out as well.
Yes, so at this point, North Simcoe Wellness Youth Hub has officially took over Pompey program, and it will be implemented twice a year through the Youth Hub and North Simcoe. We understand there are other Waihu sites away from North area who were interested in implementing Pompey as well. So it is my understanding that 4 of the Waihu sites across Ontario are kind of jointly facilitating this program online. So since this is a virtual program, there's no limitation in terms of the, physical distance, right? So we're hoping those rural areas, the youth in rural areas can participate, beyond the, physical distance to kind of jointly work together to facilitate it in a more seamless way, more frequent way. But yeah, I think that is still in the planning stage, if I understand correctly. But the goal is to really scale it up across Ontario so more youth can participate and kind of have the opportunity to, yeah, engage in this Pompey program.
And just to add to that, our work really focused on developing and piloting the program. And so just to put a call to action out there that we are very much open to working with organizations that are interested in bringing Pompey for the youth that they serve. And so we've created documents, we've created training protocols, all the works to ensure that that transition is very smooth. And so any organization that is interested, we'd be more than happy to work with them.
Amazing. It feels like we're hearing about this like almost at the start of a movement, like you're really contributing to starting this really positive wave. And it's exciting to hear about it at this stage. And I can feel that even in the questions and comments that we're getting. So I think for Irina's question, it sounds like youth can probably self-refer by contacting the Youth Wellness Hub. And we're maybe not quite sure exactly when the next group starts, but they'd find out that information when they reach out to the hub. And then Dustin Kenny from Waypoint has also mentioned that there are 3 other youth wellness hub sites in Ontario that are interested in the program. So how we will take a sort of capacity building trainer type, train the trainer type approach is sort of still in the works, but what an exciting time to be creating that in response to this growing interest. So um, I wonder if there's anything like this program is amazing. Are there other interventions that programs or supports that approaches that you've seen that you also want to sort of take the opportunity to kind of share with people? Just what else is out there that is cool and up and coming that that would be good for folks who are interested in promoting youth resilience to be aware of.
Yes, there are a lot of projects that are kind of forthcoming regarding youth mental health. One that I just come to my mind right now is related to the social media, the screen time among youth. So at the moment, we are kind of trying to understand how youth in Simcoe County are using screen time. So we believe that screen time usage has become a very critical issue among our youth nowadays, especially after the COVID-19. And with this new policy or guidelines through the Ministry of Education to ban smartphone in the schools and classrooms. So we want to understand how our kids are responding to that, and also what kind of, how they are using it. We believe that each region and each age, and each I don't know, culture has different way of utilizing screen time differently. And we want to understand that first and foremost before we talk about the impact of it. And we don't want to be biased that, smartphone is evil, we should, you know, get rid of it, but more about, how can we use it positively to benefit them and reduce those, negative impacts, right? So then but we could not do that before we understand how objectively how they're using it, for how long, what kind of usage, what are their motivation to use it, and especially with our own kids right now, right? So that's something that we are, as Waypoint, are collaborating with New Path in Simcoe County and other organizations across Ontario to really understand and have some tool or resources to better guide our youth for their, for better usage of screen time. So if you're interested about this investigation, you can reach out to me, and so we can co-design and co-produce this important tool or resources together for our youth.
Yeah, and I think the culture at the WRI is really, it's not just research, it's advocacy. So we really, really like working with the groups that and the populations that we serve. I just put in a proposal for a project to look at the mental health outcomes of individuals or youth impacted by familial intimate partner violence, and to see how we could work together to develop strategies and solutions so that mental health services and interventions can be curated and tailored to meet their unique needs. So we have a lot of projects in the works, and we'll always say support and a collectivist approach is what will allow us to meet the needs that are being expressed.
That's incredible. And actually, that last project that you mentioned, Dr. Mogami, kind of speaks to one of the topics we touched on earlier about risk factors in terms of resilience. And I know WRI is a real sort of powerhouse of research in the area of intimate partner violence. And I don't know if she's still here, I saw Dr. Hilton, our research chair, is a part of this group today as well. So it's amazing to see the collaborations that are being fostered in WRI and how that can introduce all these sort of new angles on a really complex problem. We have lots of great questions and comments coming in the chat now. Wendy Forward commented that cell phones can be an excellent support for youth with learning difficulties, which I think sort of relates to what you were saying about sort of how technology can be leveraged in a really positive way. Carrie Ann, oh, I cannot see your full name, Boucher, yes, mentioned listening to a podcast recently about how teens and youth mental health was affected by the pandemic more than other populations based on hospital usage data. So that's exactly right, and speaks to the timeliness and relevance of this research. There's some suggestions about additional folks to be in contact with to help spread the word and maybe promote the uptake. There was a question about whether you've reached out to local school boards to see if they would be interested in formally implementing the program as part of the curriculum being offered. That came from Leah Charlebois. And I'll just mention that through our Waypoints Community Leaders Forum, we do have relationships with the school board. So if that's a takeaway for us, let me know. And Doris Sheriff, one of our board members, has asked if you've had conversations with other organizations such as We Are the Villagers, whose focus is on youth. So some of that might be helpful suggestions for takeaways after today, which is amazing to crowdsource some input for the next steps at this really momentous time for the program. But if there's anything you wanted to add on those, please feel free. And then I've got about one more question that I
Nadia,
want to
I
make sure we
just
get
want to
to.
add, I just got an email that we just got a grant. Yeah, we just got the grant for IPV to be able to talk about it and disseminate and educate our community. I just got the
Wow.
so
Wow. Congratulations. That's
exciting
so
stuff.
exciting.
Yeah,
Maybe it was all the power of the amazing energy in this room with
the
you. I
community.
was
Yeah,
sitting here thinking, I hope they get it. So, congratulations. And what a privilege for us all to be a part of that moment and celebrating that with you. That's incredible.
I appreciate the support and the community. We couldn't do it without you folks.
Fantastic. Lots of recognition coming in the chat for you. So and the whole team, of course. So that's exciting. Well, I feel like we already have another episode of this series to do in a little while as you move through that project. So that's incredible. What are a few takeaways, if you think about different sort of groups that have a role to play in youth resilience and mental health, parents, caregivers, teachers, peers. Are there, maybe three or so takeaways from each of you that you would want to share about how we can all play a role in both, whether it be in promoting Pompey or whether it be in, contributing to the resilience of the youth in our lives? I know as an aunt, I would love to know, as my nieces are teens and tweens, like what does this mean for me when I leave today?
I think the most important thing is to always be cognizant of the fact that your voice matters. Your needs are going to be ones that are shared by the community that you are in. And if we have enough people speaking out and connecting with researchers who are advocating and ensuring that we do the best we can to help develop services and programs to meet those needs, that's how change happens. It can be a very daunting experience navigating through the mental health system. And the only way that we can make this easier is if we work together. And so we have to amplify the voices that require amplification.
Yeah, I just want to echo what Dr. Mogimi just said, and congratulations. And I just think it's the most important thing is this community. And like those audience, the 32 audience who stick to the last of this webinar, to the last moment, your interest, your engagement, and your caring, and your willingness to work together. I think that's the most important key to, mitigate those challenges our youth are experiencing these days. So I don't know, the communication for being open and flexible, and the willingness to work with each other openly, and that in our community, and with the same goal to support our youth in our community. I think that's the most important, and I'm very appreciative of everyone's interest and everyone's I don't know, caring for this topic, and for being here, and for everyone who organized this webinar as well. So thank you.
Fantastic. Well, that is such an inspiring call to action, and your comments make me think about, this idea that it takes a village, which, I think Doris planted the seed with the "We are the villagers." So we are the villagers who, are raising up the youth in our lives, and it's so amazing to know about this resource that can help us to do that. And the rigorous, thoughtful, partnered way in which it's been developed. And it sounds like we all can't wait to help get the word out. So what a great conversation we've had today. Jessica has popped in the chat a couple of video links, and I'm going to turn it back to Jessica in a moment to wrap things up in a good way for us. I want to just, before I do that, take a moment to thank you both, Dr. Kim and Dr. Mogimi, for not only for such an energizing and passionate conversation today that I think has really galvanized the great energy in the room, but also for all the work that you've been doing over many, many years. I would say cumulatively decades, really, to advance this field. It feels like there's more traction than ever now to talk about these things. And it's, in large part thanks to people like you and the tough work you've been doing for a long, long time. So thank you for that. I also just want to take a moment to thank all of you for joining us today. It's just been such a great group, and that we don't get to chat aloud with everybody in this format. I really have felt your presence and engagement through the chat. So I want to thank you all for taking the time, and for all your support, and all the congrats for the new grant that we did not know we were going to have breaking news in the middle of this session. So that's fabulous. And with that, I will turn it back to you, Jessica.
Wonderful. Thank you so much, everyone, for such an inspiring session today. I think it's all given us some hope for ways that we can improve the mental health services and offerings for our youth going forward. So thank you, everyone who has joined us for today's special edition of our Waypoint Talk series. We will be working together to develop additional offerings going forward. As we've noted, this is a special edition of our Waypoint Talks. We do have other Waypoint Talks formats that we will be hosting throughout the year. If you are not currently on one of our mailing lists to hear about some of these exciting upcoming events, we will be sending out a survey shortly after today's session, and we'll encourage you to advise us if you'd like to receive more information in the future. As part of that communication, we'll also be sure to share with you some of the links to the website as well as the promotional video and some of the avenues by which that you can reach out to our team should you be interested in engaging in helping to spread the news of this inspiring work. We would like to thank you all for joining us today and hope you enjoy the rest of your Wednesday afternoon. Thank you so much.
Amazing. Thanks, everyone. Take care. Until
Thank
next
you.
time.